speak for 24 minutes. You guys, if you have any questions, will type in whatever platform you're on, type in your health question, any health question. At the break, I'll answer it. Then we do another 24 minutes. Then we answer questions again. Please share this right now with anyone in your group. And if you're listening live, please put in hashtag live. This way, whoever the bots out there know who's listening live. They won't know you. They just know it's being listened live. And then also, if you're listening on a replay, put in hashtag replay. Okay? I appreciate that. But this is a great opportunity for you to get your health questions answered and to be part of the community. Because if you have a question, other people have a question as well. So, all right. Whenever we're ready to go, gentlemen. I'm ready. Okay, here we go. Hey, folks, Dr. Joe Esposito here. I am glad you're with us today. What we're going to talk about today are serious symptoms you never want to ignore. Because I've been in practice a long time, coming up on 40 years now. And patients come to me, and most of the time, 99% of the time, they're great chiropractic candidates, and they get great results, and that's wonderful. But every now and then, a patient will come in and say, well, I've been having these symptoms, chest pain, whatever it is, and I'm going to go through a whole bunch from here. And these are times that you need to get to the emergency room immediately. And I did a search on social media to find out what topics people want to hear about, of course. That's one of the ways I pick my topics. And one of the top 5 was actually this topic, which really surprised me. I was really confused by that. I didn't think this would be such a popular topic. But you don't know what to do in most cases. It's kind of like if my car makes noise. Is it something I should ignore? Is it something I should take to a mechanic? Is it something, should I drive home, not drive home? Well, when our body does it, many times you don't know what to do. And there are certain times time is of the essence. You want to get these things fixed right away. The faster you get to them, the better results you're going to have. So the things we're going to talk about today are not chiropractic cases yet. They will be in the future once we stabilize it. But right now it's going to be an emergency case and you need to get it taken care of immediately. So don't jerk around with this. And I say that because I've had a lot of patients over the years come to me and they wait so long that it's a lot harder to fix. And many, many, many times over my career, we'll have a patient come in and I'll take an x-ray and I'll see the calcification of their arteries on the x-ray. And if it's above 5.5 millimeters or 55 centimeters, 55 millimeters, 5.5 centimeters, it's an emergency case. And we need to get you to the emergency room right away. And multiple times in my career, people, I'll go next week. I got to appoint my cardiologist in a month. No, you need to go now. And they go, and oftentimes within 24 hours, they're having abdominal surgery because their aorta was about to burst. And I always get a call or an email from a doctor who did the surgery and says, Doc, you saved this patient's life. Nice work. Now, I was not looking for a dissecting aortic aneurysm. They didn't come in to me for a dissecting aortic aneurysm. We found it by accident. And even on x-rays, we'll find cancer on x-rays periodically, not very often. We'll find tumors on x-rays. And so a smart doctor knows when to co-manage the case. And it bothers me. I got an email the other day from a lady in London, and she said she's in severe pain, and she went to these pain management doctors, and none of them ever mentioned nutrition, none of them ever mentioned chiropractic. She goes, what do I do? Well, go find a chiropractor in London and do a nutrition workup. I can do that, remotely for you. And she was confused. Like, well, I just thought, of course they'd send me to a chiropractor. Chiropractic is the most effective, least expensive treatment for back pain. Why wouldn't they send me? Some doctors don't understand many doctors don't understand the value of co-managing the case with the proper specialists. I've had many times a patient goes to a physician and if they can't find out the cause, it can't be fixed. I see this all the time. Well, doctor said there's nothing that can be done for my case. Well, they're right. There's nothing that can be done by them. Doesn't mean nothing can be done by anybody. And that's what's important. And that's where a smart doctor says, you know what, this is out of my wheelhouse. I've got to refer you out to somebody else. And then have a referral network that you can use. I have an extensive referral network. So it's pretty cool. So first of all, one of the most important things you can do when it comes to emergency care is trust your gut. Most of us have a sense when a situation is serious. Well, I got a little stomach pain, my knee hurts. Now suddenly it's like, whoa, something's really wrong here. I don't want to jerk around with that. So if your instinct or your tuition tells you it's serious, go call 911, get to the emergency room right away. It's always better to err on the side of caution. I'd much rather have you go to the emergency room and they tell you there's nothing wrong or nothing seriously wrong. It's another problem I have too, is patients will say, well, I went to this doctor and he said, well, there's nothing wrong with me. And they have severe headaches, or they have diarrhea, or they have horrible gas, or they can't walk on their knee. And they say, well, the doctor says there's nothing wrong. Well, there is something wrong. You're the patient. You know something's wrong. And it frustrates me when a doctor tells the patient, you don't know what you're talking about. Well, I believe my patients. I really do. If there's a problem, we got to get in there and we got to fix it. One of the big ones, I got to start with this one, of course, is chest pain. If you're having chest pain or pressure that lasts more than a couple of minutes, or it keeps coming back, it's time to get that checked. It could be a heart attack. You shouldn't drive yourself to the hospital if you're having chest pain, because if you do have a full-blown heart attack, you can hurt yourself and other people. Ambulances are specially equipped and trained to help people more quickly. So perfect example is my father. When I was first year of college, my undergrad, I came home from being out with my friends, and he was sitting at the kitchen table, yellow, as a canary, gasping for air. And my sister was on the ambulance corps at the time, and she says, "We got to call the ambulance." No, I don't want the ambulance. I don't want the ambulance. Well, my father smoked, and my sister insisted. She called the ambulance. She called her friends on the ambulance corps, and she said, "Just come without the lights." And they took him to the hospital, and his lungs were just loaded with mucus, and they had to pump his lungs and get all this mucus out of him. And they said he had about 2 hours before he died. So he was a tough old Italian, stubborn. I don't need the ambulance, I'm fine. No, you do. And I'd rather we had taken him to the hospital and found nothing was wrong. But we did find something was wrong. Another one, kind of my dad is motivating the show today, is shortness of breath. If it happens suddenly and it's keeping you from everyday activities, have somebody take you to the emergency room. Not call 911 if it's severe, and especially if you have nausea or chest pain or you pass out. Now, if you obviously can't call 911, but somebody needs to. You could be having a heart attack or what's called a pulmonary embolism. You eat a bad diet all your life. I'm assuming, not you, because you listen to my shows, of course. But you have a bad diet all your life, and you get hardening of the arteries. You get clumping of the arteries. Calcium builds up in the arteries. If a piece of this calcium, this plaque, breaks off and goes into the lungs and blocks off the blood supply to the lungs can start to die. Okay, it's called ischemia. Ischemia means you're not getting enough oxygen and the organs start to die. And so if you can't get enough oxygen, you could pass out from it. And that's very serious. Could be deadly. So this is another reason, and all the things we're talking about today, is another reason why you want to take care of yourself. Because if you don't eat right, you will have problems. I promise you that. I'm fine. Well, I remember one of my professors used to say, it's never a problem till it's a problem. And then it's a problem. And that's exactly right. I've had people that drink. Well, I drink, it's just a couple of drinks every day. It's no big deal. And then suddenly the testosterone is zero. Their heart is having problems. Their colon isn't working because they don't have enough testosterone, because alcohol lowers your testosterone levels. Their blood pressure skyrockets. They start getting headaches, blurred vision. Alcohol, over time, will poison you. It has to. It can't not have an adverse reaction on your health. It can't not happen. And so you have to understand that if you're doing something, if you're eating bad food, if you're not taking care of yourself, if you have pain, those are warning signs. They will catch up to you. If you ever know anyone has arthritis. Anybody have arthritis? Raise your hands. A lot of you do. There's two major types, rheumatoid and osteo. Osteoarthritis is mechanical. Something is out of place and the bones are rubbing up against each other. And the body, it's more than that. It creates an inflammatory reaction. The body sends in cells to try to break up the inflammation. But there's always a physical component to osteoarthritis, 100%. And so if physical problem is the cause of it, we can take medications to bring down the pain. And if you need to do that, absolutely, please do that. But we need to put the bones back in place. Getting to the cause of the problem along with treating the symptoms. So if you eat a bad diet, you can build up calcium in the arteries, and a piece breaks off and goes to your lungs, cause a pulmonary embolism. These things, it may not be a pulmonary embolism, but you will have an adverse effect from not giving your body the minimum nutrients that it needs just to survive, much less thrive. And I see it every day, multiple times an hour. Patients come in. They're overweight. They have fatty liver. They have digestive issues, gas, bloating, diarrhea, constipation. And it's very hard for many patients to accept the fact that they caused it themselves. You have to take responsibility for your own life and your own health. And you can only do so much damage before it can't be fixed. And there's an Emerson, Lake and Palmer song called Lucky Man. And it sings about a guy who's very rich and has everything. And he went to war, and a bullet found him. His blood ran as he died. No money could save him. So he lay down and he died. Now, that's what's happening to you. Maybe not as quick as a bullet, but it's happening every day if you don't take care of yourself. You're slowly causing your own death. And sometimes it's reversible. Sometimes it's not. And when it's not reversible, every patient I've ever treated that had chronic problems that were not reversible said the same thing. I wish I'd done something sooner. I wish I realized how serious this was. I wish I didn't treat it so lightly. Everyone. I've been in practice almost 40 years. I've seen a lot of these cases. So if you have these symptoms, many times it's your lifestyle that caused them, but we need emergency care immediately. I'm Dr. Joe Esposito, by the way, if you're just tuning in. And we're talking today about serious symptoms you should never ignore. Because I always say, don't be a taint nothing patient. Oh, that taint nothing. Don't worry about it. It is something. And I wish doctors would take that stance as well. Don't be a taint nothing doctor. Well, your blood pressure's a little high. It ain't nothing. Well, maybe it's not. Maybe that's okay for you. But maybe it's a nutritional deficiency. Maybe it's irritation of your stomach affecting the vagus nerve, which affects the sympathetic and parasympathetic nervous systems. Maybe it's a pinched nerve in your neck. Maybe it's clogged arteries. Maybe it's dehydration, kidney failure, liver issues. So always look at these symptoms and say, what's causing it? What can I do to get to the cause? Other problems, and this is a serious one, if you suddenly have a vision problem, if you suddenly have blurry vision, double vision, loss of vision, that can be a sign of a stroke, or actually something more serious than that. You should call 911 if you have trouble seeing, if you have a bad headache, nausea, vomiting, numbness, weakness, dizziness, confusion, trouble talking. You know, one of the things when I evaluate patients, if we think they might have had a stroke, is I just look at them. And I make sure both eyes are equal. Make sure their mouth is moving on both sides. Make sure they can puff up their cheeks. Can they stick their tongue out? The tongue doesn't go to one side. These are all indications that you might have had a stroke. The faster we get to you when you have a stroke, the better results. Now, what is a stroke? You've heard about it. You know that people with stroke may be paralyzed on one side. You have plaque, and there's two different types, but you may have plaque float in your blood because you had a bad diet in your arteries. Piece of plaque breaks off, goes through the blood vessels, and it goes through smaller and smaller blood vessels until it gets to one that's really small. And the clot, or the plaque, is bigger than that blood vessel, so it clogs it up. So now blood can't get to the other side of this blockage. And when that happens, that other part of the part that isn't getting the blood dies. It's ischemia. And that can be a stroke, and it affects a part of the brain can't work, and so you have problems. If you have a stroke, let's say I have a stroke on the left side of my brain, it's going to affect the right side of my body because the brain crosses. The right side of the brain controls the left side of the body, left side of the brain controls the right side of the body. So we have to make sure we're getting communication back and forth. Very, very important. And if there's an issue, the quicker we can get you, many times they'll give you drugs to break up the clots. That's certainly something you want to do very quickly. If a blood vessel bursts, that's another problem. If the blood vessel bursts, you're not getting blood into the brain. That's very serious, and sometimes it's deadly. But many of these things, many strokes are self-induced. You did it to yourself through your diet. Now, there are some genetic weaknesses that may occur. You may have a genetically weak blood vessel that bursts. You just got to be extra careful with that. So you have to take care of yourself and think, all right, Mom and Dad had weak blood vessels. They had strokes. I've got to take extra care to be careful with what I do. That's why there's no downside to taking care of yourself. There's no downside to having a normally functioning nervous system, a normally functioning digestive system, and good nutrition. I said I had lunch with a former MVP baseball player. and we were talking a little bit about diet and nutrition. He was naming names of football players and friends of his. And he says a lot of them have changed their diet, including him. He's retired now. And he said, yeah, I very seldom eat meat anymore. If I do, it's a piece of fish maybe once a week. I'm eating a lot more fruits and vegetables. He says, and a lot of the pro athletes are realizing this now because they get so much better results when they don't put those heavy toxic foods, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. We talked about he ordered noodles when we were at lunch. And I mentioned wheat, and many times wheat has glyphosate in it, which is weed killer. And they spray it onto wheat to kill the wheat so it's easier to harvest. I said, so if you're going to do wheat, you want to do organic. And his eyes lit up. He says, I never knew that. He says, I thought I knew a lot about nutrition. He says, Doc, you're pretty smart. I said, yeah, I've worked at this before. So it's things like this. He goes, I love information like that. I love tidbits like that of health information. I said, well, and he lives in Macon, Georgia. I said, so you got to listen to my show. I said, and he says, well, I don't get a lot of the Atlanta stations in Macon. I said, well, go to my website or you can listen online. He says, man, Doc, he says, I'm excited. Thank you for this information. So if you have vision problems, numbness, dizziness, trouble speaking, one side of the mouth droops, one side of your eyes droop, severe pain or irritation behind the eyes, get to the emergency room immediately. So what's going to happen is these things, the chest pain, the shortness of breath, many times you did it. They'll save you in most cases. Hopefully they'll keep you alive. But then you got to say, all right, it's time for me to come to Jesus. It's time for me to realize what I'm doing is wrong, and I got to change it. Some people do, some people don't. Many times people don't know what to do. Every day, patients come to me through my website, drjoe.com. They come into the office. They'll call me. They'll call my radio shows, and they'll say, Doc, I'll do whatever you say. Just tell me what it is. I just don't know where to start. And it's interesting. Where do you start? If you have knee pain, where do you start? People, I'll go to an orthopedist. I'll go to a chiropractor. Chiropractic care is the most effective, least expensive treatment for joint pain. Start there. And if that's something that can't be fixed with the most effective, least expensive treatment, we can always refer you out. We can send you to an orthopedist, a neurologist, a neurosurgeon, a physical therapist. But let's start with the most effective, least expensive when it comes to pain, for joint pain. So if you guys would like to make an appointment to come see us, in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Go to my website, drjoe.com, drjoe.com, really simple. drjoe.com, you can book an appointment right online. Normally, the first visit is $940. That's an exam, x-rays, consultation, first treatment, going over the x-rays on a follow-up visit, and a complete nutrition evaluation. I don't know anybody who's doing that for any price, much less we reduced it for you guys to $299, $299. That's insane, just by itself. And many times, that's a great screening. We find, you know what, we do need to have a cardiologist involved. We do need to have a neurosurgeon involved. I shouldn't say many times. Major majority of times we don't. But if we do, now we can co-manage your case with other doctors. But you're suffering needlessly in most cases. And it breaks my heart to see patients every day who 10, 20, 30 years ago could have led a much more vibrant, healthy, fun, active life, but they didn't take the problem seriously. So if you have pain, that's a warning sign. Come see us. Digestive issues, heartburn, acid reflux, burping, gas, bloating. Sometimes it's a heart attack, very rarely. In most cases, the stomach is pushed up against the diaphragm, and we need to massage or adjust or pull the stomach away from the diaphragm. Number one reason we see patients is pain. The number two reason we see patients is digestive problems. And then we do a nutrition workup on all of our patients. So if you want to make an appointment, drjoe.com, just do it right now. We accept people with all insurances. Depends what your insurance covers. If there's in-network, out-of-network, my staff will answer those questions for you. If you don't have insurance, it's still the most effective, least expensive treatment for most joint pain. Why wouldn't you do it? I don't know. It makes no sense to me. And then we do a nutrition evaluation on everybody anyway. So when I talk to people, we talk about things like monosodium glutamate. People doing diet sodas. I got headaches every day, Doc, and I drink diet sodas every day. Cut out the diet sodas for a week and see if it helps. Oh, it did. Okay, great. Well, there you go. Problem solved. So nutrition evaluation on everybody because I want to get you well as fast as possible for the least amount of money. That's very different in healthcare. It's a different healthcare model because usually it's like, how much is this patient worth? We want to get you well as quickly as possible. So drjoe.com. If you have any questions, you can send me questions through my website, drjoe.com. Happy to answer your questions for you. So do that. Follow me on social media at Dr. Joe Esposito. We post every single day. You're going to get health tips more than once a day in most cases. And it's free. If you don't like it, unfollow me. It's very simple. Facebook, Instagram, YouTube, TikTok, at Dr. Joe Esposito. And if you're a podcast junkie, just go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. So what we're talking about today, folks, serious symptoms you should never ignore. And the reason I'm saying this is because I've had people come to me with a lot of these problems, and they should have been somewhere else a while ago. And it's a lot harder to fix the longer it goes. So whether it's a chiropractic case, a cardiologist case, a neurosurgeon case, we all have one goal: get to you as quickly as possible. So stop suffering and come see us. Burns. Now, we all had little minor first-degree burns, redness, swelling. It burned, you burn the skin off the first layer of the body. That happens a lot. It's not uncommon. But you need to get to the emergency room if it's a large part of your body, of your hands or your feet or any part of your body. If it's on your face, always, your buttocks, your groin, or one of the big joints, a hip joint, a knee joint, because you can get an infection because you burned off the skin, and the skin is the protective layer. If it's bigger than 3 inches, get medical care. If it's charred or white, which is a third-degree burn, and the worst one is if you burn yourself and it doesn't hurt. Because what you did at that point, you burned the nerves. And that's really serious. And I saw that once in my practice. Somebody burned themselves very seriously, third-degree burn. And they said, well, it didn't hurt, doc, so I didn't think to do anything about it. And it started getting infected. And we had to send them out to an infection specialist to get that infection under control. So don't think, I burned myself, it's no big deal. I did something a while ago. I'll tell you at the next part of the show. It's a little bit of a story. What I did when I had a very, very serious injury to my finger. And I'll tell you about that in the second half. If you're vomiting, go to the emergency room if there's blood in the vomit. And if you throw up, if you vomit, and it looks like coffee grinds, that's serious. You want to get a medical care right away. So if you throw up, and we've all thrown up, and it looks like what you just ate, it's a little slimy, it's a little yucky. But if it looks like coffee grinds coming up, you could have internal bleeding, and the blood is clotting. So get to the emergency room immediately if you see anything like that. If you're vomiting and you have a severe headache, severe abdominal pain that just doesn't go away, especially if like a half hour, confusion, rapid heart rate, you can't breathe properly, these are very serious. If a child younger than 6, they should be seen right away if vomiting lasts more than a few hours, or if they start to have sign of dehydration. They can't move. Their skin starts to turn pallor. They get cold. They turn yellow. These are all really, really serious issues. High fever, 101 for adults, 102 for kids, if it lasts longer than a day or two. Now, what you can do for a fever to help bring the fever down is you can take rubbing alcohol, put it on a cloth, and put it on their forehead. And as the alcohol evaporates, it'll pull heat out of them. But if the fever doesn't break in a day or two, that's not something you want to jerk around with. It could be a very severe infection. Now, fevers happen. The body raises the body temperature to fight off the infection because viruses die if it's too hot. And so if the fever's persistent, it could be a sign of a viral infection that's gone crazy. You definitely want to get that taken care of because that's not a game you want to play. Head injuries. I'm going to talk about head injuries. I may pick up on this later. I'm certified in traumatic brain injury and working with traumatic brain injury cases. I'm also certified in orthopedics and chiropractic and nutrition and pain management. But traumatic brain injuries are so often ignored. I got to go to break. I see that now. When I come back, I'm going to talk about how to figure out if you have a traumatic brain injury, most importantly, what to do about it. If you want to make an appointment, come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. If you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, sciatica, digestive issues, drjoe.com, we can get you an appointment this week. We always leave appointments open for new patients. So drjoe.com, book your appointment right now. When we come back, I'm going to talk about nutrition to keep the body healthy. All the supplements we have are always available on our website, drjoe.com. If you have questions, send them to me through the website, drjoe.com. Follow me on social media, at Dr. Joe Esposito. We do everything we can to give you as much information as we can so that you can naturally get well and stay well. Folks, I'm Dr. Joe Esposito, drjoe.com. Don't go anywhere. We're going to be right back. All right, a lot to cover today. Any questions?
Your lunch conversation just immediately brought me back to the gladiator diet. They didn't eat meat or dairy.
That's right. Exactly right. Yes.
They were actually known as the barley men.
They ate the grains, yes. And, in the Bible, they talk about that, where, the people that ate the food of the paupers did better than the people that ate the food of the kings. So this is nothing new. It's not like I made this up. Hey, let's eat more fruits and vegetables. No, this has been around for a long time. But the people that have lived the longest, they live in blue zones. They eat mostly a plant-based diet. Not 100%, in many of them, but some do. But the more fruits and vegetables, nuts, and seeds you eat, the better you're going to be at all healthcare. John, any questions?
I have plantar fasciitis in my feet. What can I do?
Okay, plantar fasciitis. Boy, I've heard a lot about this these past couple of days. I had like 3 questions on the website this weekend. It's inflammation of what's called the fascia, the connective tissue in your foot. Many times it's due to a bone in the foot coming out of place. So the bone comes out of place, it puts stress on the fascia, and it causes an inflammatory reaction. The medical treatment is steroid injections, which may help short term, but it doesn't put the bone back in place if that's the cause. So what we do is we adjust the foot, we put the bone back in place, we check the nerves in the low back, they control the foot. Then we also have a machine called an acoustic wave therapy machine, where we send very fast impulses into the joint to break up the scar tissue that forms and increase circulation. Now, the acoustic wave, shock wave therapy, it's called sometimes, is amazing for joints, the knee, the hip, the shoulder. It can also be used for erectile dysfunction. You can send impulses into the area to increase blood flow and grow new blood vessels. So you want to come see us for that, because chances are if you just do steroids, it's never going to get to the cause. And we want to get to the cause of it. So that's a physical problem. Come see us. What else?
What are some causes of bad breath besides diet?
Rotten tooth. There's 2 different types of smells. One is like a rotten tooth, garlic. Well, you just ate something and that's a dental issue, or you ate garlic. The most common one by far is the food is not being digested properly in your colon. The stomach has a tendency to push up into the diaphragm in many cases, so the food is not being digested in the stomach properly. So it passes from the stomach into the small intestine, partially digested, where essentially it rots. When it rots, it gives off that bathroom smell. It smells like a potty. And if you have somebody with that breath, it's almost always the stomach up against the diaphragm. It's a digestive issue. Because the smell, the rotten fecal sulfur smell, gets absorbed into the blood system, goes through the body, and then comes out through the lungs. So if you have that type of breath, you want to come see us, because we've got to fix your gut. And hopefully we can fix it and make it go away, because the bad breath is a symptom. It's not a problem. It's a symptom. Find out what's causing it. You can't brush that one away. That's a digestive issue. So come see us for that. What else?
What do you think about vibration plates to help strengthen bones and your core?
I love them. I think they're great. I can't use them because I have a fracture in my low back, and I've used them in the past, and it irritated my fracture, and so it hurt like heck for me. But generally speaking, I think vibration plates are fine. What else?
What can be done about excessive mucus?
Cut out wheat and dairy is the first step. Wheat and dairy. Dairy is the number 1 mucus producer. Wheat is number 2. So cut out wheat and dairy. Cut it out. Don't cut back. Cut out. Not a sip, not a bite, not a nibble. Cut out the wheat and the dairy, and many times that drops the mucus dramatically. And if that's still an issue, then the stomach might not be digesting food. Then we got to pull the stomach away from the diaphragm and get you on digestive enzymes. So cut out the wheat and the dairy. Supplement-wise, I'd say Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those are the minimum ones you should be taking. There's some samples of them right there. Super Greens and Essential Source. And then a digestive enzyme. Do I have any here? I don't know. Digestive enzyme, I take it whenever I eat a cooked meal. Today for lunch I had salad. I don't need a digestive enzyme. Tonight I'm probably going to have split pea soup. I'm going to take a digestive enzyme with it. So digestive enzyme, cut out the wheat and the dairy, Super Greens and Essential Source. They're on the website, drjoe.com. If it doesn't go away in about 2 weeks, then come see us and we'll check further.
On that point, should everyone take digestive enzymes every day?
I take it whenever I eat a cooked meal, and you probably should too, especially if you're over 30. So, yeah, cooked meals, you don't have the enzymes. You cook them out, anything cooked above 110 degrees. So I take a digestive enzyme whenever I eat a cooked meal. So today so far, I've eaten nothing but raw food. I had fruits and vegetables for breakfast. I had fruits for breakfast, actually. I took Super Greens and Essential Source, of course. I took my supplements. Lunch, I had a salad. So, again, no need for enzymes there. But yeah, the more raw food you eat, the less likely you are to need them. If you're over 50, you probably want to take one with every meal. Now, I'm way over 50, but I know my body and I can get away with it because I eat a lot of raw foods. What else? And they're on the website, drjoe.com, in the store section. Yes.
Are there any ingredients in shampoo that I should avoid?
Yes, almost all of them. You want to get a shampoo that doesn't have phthalates, sulfates. Look for it all natural. It'll say no phthalates. No phthalates are chemicals that can affect your hormones. Sulfates, sodium lauryl sulfate, things like that are just foaming agents. Shampoo doesn't have to foam, neither does soap. We put these things in there just as a foaming agent, which looks good, but it's not good. So look for one that you can pronounce all the ingredients. And they're hard to find because those chemicals can be absorbed right into your scalp, and that's why I'm very careful about the shampoo I use. So, and you should too. What else?
That's it for now.
Beautiful. All right, guys, going to do part 2. Make sure if you're listening live, put in hashtag live. If you're listening on a replay, put in hashtag replay. Okay? Something else, John? John's looking intently. No? We're good? Okay. Garrett, we're ready? Okay. All right, here we go. Hey, folks, Dr. Joe Esposito here. If you're just joining me, welcome. Glad you're here. If you stayed with me, thanks for being here. We're talking today about serious injuries or serious conditions or symptoms you should never ignore. Because so many times in my career, people have come to me and the condition has progressed. And it would have been a whole lot easier to fix earlier. Now, some of the things we're talking about could be deadly. And you don't want to jerk around with that. We started talking earlier about head injuries. A bump on the head can be serious and need medical care right away. You could have a seizure. If you have a headache that won't go away, persistent vomiting and nausea, slurred speech, you get confused, weakness, numbness, less coordinated, you start stumbling. These are all signs of traumatic brain injury. Now, the traumatic brain injuries, and again, I'm certified in this too, is mild and there's severe. Now, I've had a severe traumatic brain injury. I was hit by a car when I was about 10 years old, and they thought I was dead. They covered me up on the side of the road, and when they put me in the ambulance, I moved. Obviously, I didn't die. But it left permanent damage. Traumatic brain injuries never get 100% better. They always seem to linger. And when I was studying to get certified, it was a big book, and most of the book was about what if you have it? How do you deal with it from a financial standpoint? What about wheelchair access? What about family issues? How to deal with the mood swings? Very little in my training ever talked about what to do about it, not about what the symptoms of it, but what to do about it. So if you've ever been in a car accident, chances are you had a traumatic brain injury because your head will snap forward and backwards. You might call it a whiplash. But your brain floats in your skull. It's attached in different places, but it's essentially floating in something called cerebrospinal fluid. So when you get hit, if let's say you get hit from the rear, your head snaps backwards and your brain actually can slam into the front of the skull. Then as your head goes forward, the brain can slam into the back of the skull. It's called an acceleration-deceleration injury, sometimes called a contre-coup injury, which means in French back and forth. And if the brain slams into the skull, the brain essentially gets bruised. Now, certain things you always want to avoid if you've ever had a traumatic brain injury, and I will vouch for this, monosodium glutamate. Monosodium glutamate? What the heck does that have to do with my brain injury? When the brain is injured, it releases a lot of something called glutamic acid. That's the glutamate part of monosodium glutamate. So glutamic acid is an excitotoxin to the brain. It can cause the brain to fire faster than it's supposed to and can cause a lot of pain. In fact, one of the side effects of monosodium glutamate, many times used in Chinese food, but a lot of processed foods, is headaches. And so if you have headaches, anybody who has headaches, you always want to stay away from monosodium glutamate. Now, monosodium glutamate has over 40 different names. Autolyzed yeast, hydrolyzed vegetable protein. Natural flavors can be monosodium glutamate. Sneaky how they do that, isn't it? So you want to be really careful with monosodium glutamate if you have headaches and if you have a traumatic brain injury. The other one you want to avoid is aspartame. We want to avoid these two anyway. But if you have a TBI, traumatic brain injury, you can be affecting the aspartame as an excitotoxin to the brain and can cause the brain to fire faster than it's supposed to and can cause serious issues. So if you have a TBI, and again, I was hit by a car, I was 10 years old, I was in Germany actually, and they brought me to the hospital. They didn't have MRIs, they didn't have CAT scans at the time. I laid in bed for 3 days unconscious. That's why it was a severe traumatic brain injury. And my head throbbed. And they wouldn't give me any medication because the philosophy at the time, and it probably wasn't a bad philosophy, was that if we cover up the pain, we won't know if it gets worse. I would have been thrilled for an acetaminophen or something like that. So because of that, whenever I injure my neck again, if I just get stressed out, if I lift too heavy, the exact same pain I had when I was 10 years old comes right back. So it's the exact same area of my traumatic brain injury. And what happens is if I do any monosodium glutamate, I remember one time I was at one of my favorite Thai restaurants. I've had a new one since then. I said no fish sauce because fish sauce has monosodium glutamate in it. And they said, oh, we don't use fish sauce. No, we won't put it in there. Don't worry. So they brought me the dish. And, of course, I'm plant-based, so it was all plants. And I tasted it, and I said, this tastes like fish. No fish sauce, no fish sauce. I believe them. I ate it. Man, did I get a blazing headache. Exactly where the traumatic brain injury was. Too much glutamic acid, monosodium glutamate. So I got to be really careful with monosodium glutamate, and I don't do any artificial sweetener. I never have, so I don't know if that would affect me, but it affects most people. So diet sodas, sugar-free gum. Most gum is sugar-free now, unfortunately. Candies, mints, many of them artificial sweetener. So we have over 6,000 items with aspartame in them now. And if you have a traumatic brain injury and you get headaches, you might be making the headaches worse just by what you ate. That's when I talk to my patients. I oftentimes say to them, write down everything you eat for a couple of days. Don't lie, just write down everything. And I'm able to go through the list and say, wow, I can see this, and these are things we want to avoid. So traumatic brain injuries, very serious. Again, if you start getting numbness, tingling, loss of consciousness, dizzy, blurred speech, get to an emergency room right away. In case there's bleeding in that area, they may have to take care of it. A friend of mine, unfortunately, a great man, Richard Thomas, a very good friend of mine. He was the president of Kentucky Fried Chicken. He started a small company called Bojangles. You may have heard of them. And he then realized he was killing people with what he was serving them, sold a whole chain of Bojangles, and opened up a cafe in the Atlanta area. And he and I became very, very good friends over the years. And he was in his 80s, and he fell and hit his head. And he had bleeding inside his skull. And they had to remove a piece of his skull to let the bleeding out because the pressure was building up, and unfortunately passed away from it. So head injuries are not something you want to take for granted. Had I known then what I knew now, I would have treated this traumatic brain injury very differently because I played football after that. I played hockey after that. I did a lot of sports, and that's not something somebody with a TBI should be doing at that level, that intensity. I should have done tennis. I should have learned how to play the guitar. But I was a physical, crazy little kid, and it caused more damage to my brain. So just be very, very careful. Don't jerk around with head injuries. Deep cuts. We're talking today, if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about serious injuries that you don't want to ignore. If you see yellow fatty tissue under the first layer of skin, you probably want to get that taken care of at an emergency room. Now, you need quick attention. If it won't close, especially if it's on your face, your neck, your genitals, across a joint, again, you run the risk of infection. You should always go, if you've been bitten by a person or an animal, to clean that out and get anything out if you step on a rusty object. If you're bleeding badly, if you have a foreign object stuck in the cut, of course. But I was doing yard work, I don't know, maybe 4 years ago, and I was trying to move this big boulder out. I was planting some trees, and there was a big boulder, and I put a pitchfork underneath it, and I was trying to use it as a lever, and the pitchfork slipped, and I don't know what happened, but my index finger was crushed. And the top of the bone was just torn off. The top of the skin was torn off, and I could see the bone underneath it. And it was rough. It was really scary. And I had to run. I have a stream. I jumped over the stream. I ran up to my house. I started washing it out, and I could see the bone, and I said, something's wrong here. So I immediately went to an emergency room, and the doctors looked at it, and they said, we can stitch it, but it looks like it's a clean cut, and it'll heal on its own. And it did. However, that joint on my finger is still crooked. It's still bent. So I'm glad I went and got medical treatment for it. I didn't need a stitch for it, but the damage was now permanent. And feeling's fine, but the fingernail grows slower than the other ones too. So when you have an injury, especially a deep cut, you definitely want medical attention for that because that's not something you want to jerk around with. That's why I went immediately to the doc in a box, and they didn't even treat it. They said, "Oh, you're fine. Don't worry about it." But better safe than sorry. Okay. So if you're just tuning in, I'm talking about symptoms that you should never ignore. Stomach pain. Now, a lot of patients come to us with stomach pain, and they might have heartburn, acid reflux, burping, gas, bloating. But if it's severe and lasts more than 30 minutes, especially if it's sudden and intense, you should seek emergency care immediately. Pain that doesn't get better or happens with vomiting could be something like an inflamed appendix. Now, if you have pain on your lower right quadrant, between your belly button and your hip bone on the right side, and you have a severe stabbing pain, you're doubled over in pain, and you have a fever, your appendix might be ready to rupture. Get to the emergency room. If you're in severe pain and suddenly the pain stops, boom, doesn't fade out, just stops, get to the emergency room. Because that could be a sign that the appendix burst. If the appendix burst, fecal matter can get into your abdomen area, and that can be deadly. Fecal matter is loaded with viruses, germs, bacteria, and it's supposed to stay in the colon. It's not supposed to get out into the outside area. So if you have severe pain and then it suddenly stops, not a good idea. For gentlemen, if you have testicular pain and swelling, especially if you have an injury, that can be serious problems. If the pain is radiating up into the abdomen and it hurts really bad, that can be a problem. If you have nausea, vomiting, fever, if you feel a lump, especially in your scrotum area, that can be pretty serious. I remember I played hockey. I got a lot of stories about emergencies, don't I? I used to play hockey, and we were playing street hockey, and I was in 8th grade, and I was really good. And there was a semi-pro team that played street hockey in the summer and asked me to be on their team, and I was in 8th grade, which I thought was the coolest thing in the world. And we were jerking around, and I was stupid. I didn't wear protections, and it was between periods, and we were jerking around, and I stood in the goal, and the guys were just kind of peppering little shots at me. And I wasn't a goalie. I was a forward. And the one guy took a shot, and I still remember it, clear as day, and it was heading right for my groin area, and I couldn't move fast enough. And it hit me so hard that I don't remember getting hit. I remember being in the parking lot. How I got to the parking lot, I have no idea, writhing in pain. That was a serious injury, and had I known now, then what I know now, I would have gotten to the emergency room immediately. I didn't go. So that could be a very serious issue. So gentlemen, be very, very careful because that's a very delicate area there, and a lot of blood vessels, a lot of nerves in that area. And if there's swelling, it could lead to some serious issues later on in life too. We talked about fever. If a baby's younger than 3 months and has a temperature of more than 100.4, they need to be seen right away. So young babies, fever you don't want to jerk around with. Fever of 102 for 3-year-olds and over, an adult fever 104. Make sure you monitor that. If it spikes, if you start getting delirious, if you start seeing things, you start hearing voices, that's a serious issue, and you want to get that taken care of. And I saw this a lot with COVID. When people had, if they had the infection, they tried to ignore a lot of things. And most people did okay. They made it through. But if it gets high, again, for adults 104 or higher, it's something you want to consider getting checked. Because it may be an infection somewhere, and the body raises the temperature to kill off the viruses. Well, what's causing that infection is the problem. Again, it could be a burst appendix. What we're talking about today are signs and symptoms you should never ignore. Now, we talked a little bit about this if somebody has a stroke. Two of the most common symptoms of a stroke is you have confusion and trouble speaking. Where am I? And they sound like you're drunk, and you notice the face drooping on one side. That's an emergency. You want to get medical care immediately. Other stroke symptoms may include problems like walking imbalance, intense headache. We talk about drooping on one side of the face, muscle weakness on one side of the body. They're dragging their foot. They can't move their wrist. These are very serious issues, and you want to get that addressed immediately. You think, it tain't nothing. Again, I'm telling you, don't be a tain't nothing person. So whether it's a serious problem like this that needs immediate medical care or non-life-threatening, for example, neck pain, back pain, sciatica, shoulder issues, headaches, you want to address them as quickly as possible. If you put off health care, sometimes it gets better. Again, we're talking about the ones that need care. It can be very serious, sometimes life-threatening. So if you have pain, neck pain, back pain, shoulder pain, that's a warning sign. That's telling me that there's something wrong. And chiropractic care, most effective, least expensive treatment for joint pain. So why wouldn't you do that? That should be your starting point. So if you'd like to make an appointment for you, your friends, your family, your children, go to my website, drjoe.com, drjoe.com. You can set up an appointment right now. We have appointments available every week. We always leave new patients' appointments available. And we can get you seen sometimes same day or the next day. But we want to find out what's causing the pain. Why do I have these issues? Most cases, chiropractic care is all you need. Sometimes we need a medical intervention. Sometimes we need an orthopedist, a neurologist, a neurosurgeon. And I have a team of doctors that I know personally. I have them on my speed dial. And we can get you out as quickly as possible. But stop suffering needlessly. So many people suffer, let's say, back pain for years and years and years. Then they come see us. We take an x-ray. They have severe arthritis. The joints are worn out. And I tell them, arthritis occurs because the bones are out of place rubbing up against each other. It's a mechanical problem. The quicker you tune it up or put it back in place, the less likely you are to have severe arthritis. Well, nobody ever told me that. Well, I'm telling you guys now. You guys are the people that are most important to me. I want to give you this information so that you don't act like so many other people and you can't plead ignorant. Your back is worn out, it's worn out. I don't care if you're ignorant or not, it's worn out. So if you have back pain, neck pain, shoulder pain, go to my website, drjoe.com. Book your appointment now. Do it right now. Normally, the first visit is $940. I've reduced that for you, my listeners, because I care about you so much, to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. So I'm happy to get you seen. Let's get to the cause of your healthcare problems, not just treat the symptoms. I think that's what I think every patient that's ever come in my office wants that. They all say the same thing. I want to find out why I'm having this. Not just covered up, why I'm having it. So if you're just tuning in, we're talking about signs and symptoms you don't want to ever ignore. Broken bone. I've broken bones before. I broke my wrist twice. When it breaks, you know it. Let me tell you, it's not a game. And you think, oh, I can move it. Oh, I can't move it at all. It's broken. If you think it's a broken bone, especially if it pierces the skin, if it looks deformed, if it starts turning blue, get to a medical doctor immediately. This applies to bones in your neck, your head, your back, if there's heavy bleeding, because broken bones, if they start bleeding out, can cause really serious problems. Again, ischemia, which is cutting off the blood supply to an area, could actually kill that area. And we don't want that. So if you think you broke a bone, go get it checked. Now, there is something called an occult fracture. And some doctors don't know this. But I can break a bone, and I've seen this many times in my practice. Somebody comes in, they think they broke the bone. We take an x-ray, the x-ray is fine. But the pain is still there. I said, come back in 2 or 3 days, we're going to take another x-ray. But you just x-rayed it, it's fine. Sometimes the fracture doesn't show up for a couple of days. And it's wild. I've had before and after. Bone is fine. 2 days later, you can see the bone is snapped in half. So if the pain persists, you might want to take a second x-ray. Don't think, well, I had one x-ray. It's already fine. I get it. Let's go check it again just to make sure. X-rays are pretty quick. They're pretty inexpensive. And we can find out what's going on in there. You don't want to jerk around with that. So broken bones are not something you want to ignore. If somebody has a seizure, and I've had many patients over the years have seizures, if you've never had one before, if you're pregnant, if you're diabetic, seizure calls for the emergency medical care right away. And I've had patients come in and say, Doc, I have seizures all the time, and what can you do for me? So sometimes just adjusting the atlas, the upper bone, putting that back in place takes the pressure off the brain stem, part of the brain that becomes your spinal cord, and that can cause the seizures. I've seen it happen in humans. I've seen it happen in dogs. And putting the bone back in place many times helps that problem. Other things that can cause seizures would be monosodium glutamate, MSG, aspartame, bad diet, dehydration, stress. And so if somebody's having a seizure, until you know that it's safe, you want to get medical care. I remember I had one patient, and she would come in, and I remember she seized while I was holding her, and she collapsed in my arms, and she was about my size woman. And we had to lay her down, and she was just seizing and shaking and seizing and shaking, and we made sure she didn't swallow her tongue, and we adjusted her, and as soon as we adjusted her, she came out of the seizure. And it was almost like this was set up, right? This can't be real. This looks fake. And the staff at the time were like, what did you just do? I said, well, her atlas, her top bone, was way out of place, and we popped it back into place, and it helped tremendously. But we want to avoid certain things with seizures, especially monosodium glutamate and aspartame, artificial sweeteners, because they can trigger seizures. And I've seen it happen so many cases. And parents with kids having seizures, and I'll get them off the artificial sweetener and, you know, the diet sodas and the candies, and the seizures go away. And the parents are like, how did you know that? I said, I didn't know it. I just know that it can cause seizures. So just be careful with those artificial sweeteners. I'm not a fan of any way, shape, or form. Other issues that you want to make sure you don't ignore. If you have vaginal bleeding during pregnancy, if that's an issue, you want to get to the medical doctor right away. Okay, if you have cramping, dizziness, pain in your belly or your pelvis and it's stabbing, don't jerk around if you're pregnant. Get yourself to a OBGYN doctor, somebody who's an expert in that field, because it could be a very serious issue. And if you take blood thinning medications, and I've had a lot of people do this over the years, even a minor injury can be serious if you're on blood thinners. So if you have an injury and your heart rate or your breathing starts going really fast, or you have trouble breathing, you have a headache, you feel sleepy, faint, dizzy, if bruises start getting larger and larger, that can be a sign of internal bleeding, and you want to get to the emergency room right away. So there's a lot of things, and I can go on for hours on this, on if you have a symptom, you don't want to ignore it. And those, the ones I just listed, I think there was, 15, 16 that I just talked about, you certainly don't want to ignore them. But any type of symptom, persistent headaches, numbness, tingling, sciatica, acid reflux, heartburn, burping, gas, bloating, your breath smells like a toilet on a regular basis, your jaw clicks, you can't move your shoulder in full range of motion. These are all warning signs. They may not be life-threatening, but they can become very serious later on. And so in our office, we always check the joints to make sure all the joints are lined up. We check the nervous system. We check the digestive system. Do you have heartburn, acid reflux, burping, gas, bloating, diarrhea, constipation? Those are warning signs telling you something's wrong. And is it diet? Is the stomach up against the diaphragm? Is it a pinched nerve going to the colon? We do an analysis to find out why you're having it. And then, of course, diet. And diet is the one thing that you have total control over. You can't control your genetics. You can't control the fact you might get in a car accident, but you can control your diet. And that's probably 80% of your health. I heard one doctor the other day, a geneticist, say, 15% of your health is your genes, 85% of it is what's on the end of your fork. So even if you have a genetic predisposition, just eat better. If you don't know what to eat, go to my website, drjoe.com. Type in 7 Deadly Sins of Nutrition. And that's a talk I did, and it talks about the 7 foods you want to cut back or cut out of your life. Then type in, so what can I eat? And you could listen to a show we did on what you can eat. So it breaks it down very simple for you. It's not really tricky. The minimum supplements I would suggest, minimum, for everybody, would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. I take a scoop of each. I mix it with coconut milk, almond milk, water, and I start every day of my life with that drink. Now, you want to shake it up, throw in some frozen fruit, whip it up, make a smoothie out of it. I add vitamin D to mine as well because I know I'm vitamin D deficient because I'm not out in the sun as much as I should be. So I add a liquid vitamin D to it, and I drink it every day. Now, there's 3 different types of Essential Source, of Super Greens, There's plain, there's mint, and there's hemp. Hemp, by the way, is half price right now. We only have a few more weeks of that special, so you want to stock up on that. But the plain is plain flavor. The mint is sweeter, and that's the one I actually like. So I take the mint and the Essential Source, mix it together, start every day with it. If you're not doing that, I don't know why you're not. And at least try it. Give yourself, 3 or 4 weeks of taking it every day. Watch what happens. It's pretty incredible. Okay? So we do a custom diet plan for everybody who comes in our office. Vitamin D, most people are deficient in. B vitamins, there's different types of B vitamins. You want to make sure you get the methylated kind. That's the kind we have on our website. Adrenal support, hormone support. We have a weight loss protocol, 21-day weight loss protocol. That's amazing to reset your brain, not just lose weight, but set your brain. So nitric oxide increases circulation to the brain, the sex organs, the heart, the lungs. So we have a protocol for pretty much everything. So if you want to make an appointment to come see us, go to my website, drjoe.com. You can order the supplements right there, but make an appointment. It's even more effective. And we'll set up a time to see you. In the Atlanta area, Marietta, Duluth, Stockbridge, and West Cobb. If you're not in the Atlanta area, we could always do a remote or come see us, even better. Podcast Junkie, Dr. Joe for the health of it. Just go to your podcast service and follow us on social media. We post every single day. We post health tips every day. My goal, after 40 years of doing this, I want to naturally get you well and keep you well. Folks, I'm Dr. Joe Esposito, drjoe.com. Thanks for tuning in. We'll catch you next time. All right. You got questions?
What special ingredients are in apple skin?
Well, pesticides is one of them. If we just talked about this today. I had lunch with Ryan Klesko today. I don't want to say it on the air, but Ryan Klesko and I had lunch today. And we were talking about apples. He goes, "Oh, Doc, you're killing me with the apples here." So if you're going to do apple skins, make sure they're organic, okay? Because organic apples don't have the pesticides. If they are sprayed with pesticides and chemicals, they're oftentimes dipped in wax to make them last longer. But in the process, you're sealing in the junk. So either peel your apple if it's not organic, or make sure you do organic. There's fiber, there's phytonutrients, iron. If it's a red apple, it'll have some iron in there. Anything red is going to have iron in it. So I'm not sure exactly where you're going with this question, but there's a lot of good nutrients in it, especially the fiber. So fiber is probably the most deficient one nutrient that most people are deficient in. What else?
I was put off of a certain medication for a large blood clot in my leg. What do you recommend besides this medication to dissolve the clot? Is turmeric an option?
Turmeric's an option. Nattokinase is an option. Nattokinase. But really the most important thing you can do is just cut out the meats and the dairy products. If you cut out the meat and the dairy products, eat something raw at every meal, take Dr. Joe's digestive enzyme every meal, over time, that clot should dissolve itself. Now, again, I'm not a cardiologist. I'm not a vascular surgeon. But I know that if you eat a plant-based diet, chances are it's going to help clean out the arteries. So don't stop taking your medication. Just start, Super Green Essential Source. Now, Essential Source has vitamin K1 in it. Vitamin K1 can increase your clotting. Now, I have to ethically tell you that you got to be careful with vitamin K1. However, you need vitamin K1. So just ignoring it is not a good idea. So this is what I tell my patients on blood thinners. Tell your doctor you're going to take Super Greens and Essential Source every day. You have to take it every day because you got to set a new norm. I'm going to take Super Greens and Essential Source every day. And then monitor my blood. See if I need to change my medication. The only change in medication I've ever had a patient ever have to do is reduce their medication. They never had to take more. But just tell your doctor what you're doing so they can monitor your blood. Okay? What else?
I cut my oranges in slices and suck out all the juice that way. Is that the best way to get all the nutrients?
You want to make sure you're eating the orange itself. Don't just suck the juice out of it, because the fiber is really the key. Because if you're doing fruit juices, you're basically sucking down sugar water. So you want to make sure you're doing the fiber and eating the whole, not the skin, but eating all the orange as well. That's the most important thing. Yeah. And try to do organic if you can, as always. What else?
We have a listener who's actually recommending an entire show on Super Greens and Essential Source.
Okay. I can do that. I can do it right now if you want me to. It's not a bad idea, actually. All right, I'll consider that. Thank you.
That's all we got.
You guys are awesome. Thank you so much. Sorry for starting late today, but I will see you Sunday, 8 to 10 on WSB Radio in Atlanta, and then I'll see you back next week. Send me questions through the website.